Good afternoon, and thank you everybody for joining. Let's learn about brain health and dementia. Today is Wednesday, February 25th, 2026, and today's presentation is brought to you by Neurobridge MUN. Before we begin, we have a few housekeeping rules. Please mute your mic to block out any outside noise. The closed captioning screen is on the bottom of your screen. I should say closed captioning button is on the bottom of your screen. Please place your questions and comments in the chat. And of course, as always, we will have a question and answer period at the end of the session. You can also, at the end of the session, please take yourself off mute and ask your questions. This session will be recorded and placed on Seniors NL website and our YouTube channel. Barb, can you please go ahead and read the land acknowledgement?
Okay, can you hear me?
Yes, we can.
Okay, good afternoon. We respectfully acknowledge that the lands on which we live, work, and meet are situated on the traditional territories of the indigenous groups of Newfoundland and Labrador. And we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We honor the diverse indigenous peoples who have cared for this land for past generations and for the 7 generations to come. We are committed to listening, learning, and working in collaboration with indigenous communities as we move towards reconciliation, respect, and mutual understanding. Let us carry this acknowledgement forward in our work and relationships as we strive to create a future that respects and embraces the wisdom of older adults and the diversity of all communities.
Thank you so much, Barb. Now, without further ado, I'm going to hand it over to our lovely group, Neurobridge. Here you go. You can introduce yourselves.
All right. Hi, everybody. Welcome to our Brain Health and Dementia Awareness Workshop. My name is Abby, and alongside me, I have 2 other members of our Neurobridge group.
My name's Theo Brown.
And I'm Brianna King.
And today we are going to give you a workshop to help us understand dementia better, especially Alzheimer's disease, and learn practical ways to support brain health. So if you have any questions or comments along the way, interrupt us. We want this to be as interactive as possible. So, just as a little presentation outline for us, we'll get started with a little bit of trivia to test our knowledge, and then we'll move on to a definition of Alzheimer's disease. We then want to talk about risk factors for Alzheimer's disease, so ones that we can change and ones that we cannot change. We then go on the diagnosis and treatment of dementia. What can we do about it? We'll do the trivia again, just to see if everybody's listening. And then we'll end it with a little bit of Q&A. So, before we get started, let's do a little bit of trivia. So, for each of these questions, I want you to tell me if it's true or false. So, number 1, Alzheimer's or any form of dementia is a normal part of aging.
False.
No.
Well done. That is false. People with Alzheimer's typically lose recent memories before older memories.
True.
True. Well done, everybody. Social isolation can increase risk of cognitive decline in Alzheimer's.
True.
Look at that. If someone in my family has Alzheimer's and dementia, I'm going to get it.
False.
That is an A+, everybody. Well done. Well done. All right, moving on to what is dementia.
Education.
So, dementia is a non-specific disease, and the term dementia itself is an umbrella term used to describe the range of symptoms that come along with cognitive impairment. So these include a loss of memory, thinking, reasoning skills that then go on to interfere with your daily life. So your ability to complete activities, dressing, washing, shopping, finances, that gets impaired from the cognitive impairment. Alzheimer's is the most common cause of dementia. So that is 50 to 75%. And then vascular dementia being the second most common cause. The difference between those two, Alzheimer's is caused by proteins called beta amyloid plaques and tau tangles in the brain that affect the circuitry and your brain's ability to function. Whereas vascular, the second most common type, is caused by reduced blood flow to the brain due to strokes or small vessel diseases. Okay, now, what is Alzheimer's? So Alzheimer's is a chronic neurodegenerative disease that destroys brain cells, causing thinking, ability, and memory to decline over time. So let's just think about an analogy together just to understand Alzheimer's. So I want you to think of your brain like a big library full of a lot of magnificent books, and the books being your memories and your knowledge. Each book contains important information about your life and how to do things. So in Alzheimer's, let's think of it as a slow rainstorm that starts inside the library. So first, it damages the newest books, so the books that are in the front shelf. And then as the rainstorm gets worse, then it goes on to the later books, so your more later memories as opposed to your recent memories. The librarians, or your brain cells, try to fix things, but it's progressing, so they can't, they stop working and they can't fix it over time. As time passes, the more of the library that gets wet and damaged, more the books become hard to read or get lost entirely. Eventually, even the oldest, most important books, like memories of her family or how to do the most basic tasks, become damaged. The rain doesn't damage all parts of the library at once or in the same way, which is why people with Alzheimer's may remember some things perfectly while forgetting others. All that is to say is Alzheimer's begins by destroying your recent memories, and because it is a progressive disease, it gets worse with time. Now, what causes Alzheimer's? So using our analogy, the books are our neurons, which are little tiny cells running your brain. And the rain, the thing that's destroying the brain, is the amyloid beta and the tau proteins. Any questions so far, anybody? Perfect. All right. Now, let's go on to some common misconceptions. So, like we discovered in our trivia, Alzheimer's is not a normal part of aging. It involves distinct brain changes beyond that we would typically see in normal aging. Memory loss means you have Alzheimer's. That's not true. Many conditions other than Alzheimer's also cause memory issues. So stress, some medications cause memory loss. So memory loss can also be a normal part of aging. And then finally, nothing can be done for someone with Alzheimer's. That's also not true. Even though there is no cure yet for Alzheimer's, medications and support can help manage the symptoms and improve the quality of life for those with Alzheimer's. Okay, now, it's important to know the difference between mild cognitive impairment and Alzheimer's disease. So mild cognitive impairment, to begin, causes cognitive changes that are noticeable but don't significantly interfere with your daily activities. So someone with a mild cognitive impairment might have memory problems, but they can still manage their finances, they can still drive, and they can still shop independently without needing help from somebody else. In contrast to that, Alzheimer's disease affects your daily functioning and will get worse over time. So activities of daily living that may become difficult include dressing, preparing meals, and even walking safely. So let's just think about the difference here. So mild cognitive impairment, a 72-year-old retired physicist who gets lost on transit but lives independently. So they get lost, but she's still able to live in her condo on her own. So this would be mild cognitive impairment because she doesn't need help living independently. Whereas someone with Alzheimer's, we've got a 50-year-old veterinarian who was forced to retire due to forgetting drug doses. So this veterinarian has been working, let's say, for 30 years. They've been doing the same drug dosing over and over again. But due to Alzheimer's disease, they can no longer function the same way they can in a job that they've done for the large part of their life. So that one is affecting their daily living and could be consistent with early Alzheimer's.
Can I ask a question?
Of course.
The underneath the Alzheimer's there, the second, I'm gonna say bullet.
Yep.
When you're referring to eating, are you actually referring to the physical motion of eating, like feeding yourself, or just eating in general? Say, I have no appetite, I want no food, I don't like anything, or is it a combination of everything?
I think it's a combination of everything because some people with Alzheimer's might forget what hunger feels like, so they may forget that they're hungry. They also may forget, like you said, the mechanics of, okay, to eat this soup, I need to bring the spoon to my mouth, and then I need to remember, okay, to swallow. And where Alzheimer's is affecting your brain to such a large degree over time, sometimes those swallowing mechanics may not work anymore.
It could also be just forgetting how to cook the same recipe you
Exactly.
cooked for 20 odd years.
Yeah.
That'd be more so Alzheimer's.
Right, right. Okay, thank you.
No problem. Okay, so symptoms. I'm gonna hand it off to my friend Theo.
Thank you, Abby. So far we've discussed, what is dementia, and we discussed how Alzheimer's kind of fits under that umbrella. And we're going to talk a little more about how does Alzheimer's present itself in various people. And I think the most important thing to consider regarding Alzheimer's is how different it can look from amongst different people. Someone may express all of the symptoms are related to Alzheimer's. Some may only have one or two for a long period of time. Some people worsen very quickly. Some people live a long time, and while struggling with some of the aspects of Alzheimer's, can function relatively well for a longer period of time. So symptoms will start mild, but as Alzheimer's is a neurodegenerative disease, it will worsen. So this is why it's different than normal aging. We'd expect a certain decline in your cognitive abilities, or maybe your ability to recall certain memories, but it'll plateau, whereas Alzheimer's will continue to get worse. So the most common thing we associate with Alzheimer's is memory loss. So when it initially begins, it tends to start with new information, and over time it'll kind of start to impair memories that have been held longer, such as childhood memories. But there's a large span of other ones, such as lowered attention, so difficulty multitasking, misplacing things. For example, the example of eating, in this case, when you have a difficulty maintaining concentration, once you might start to make yourself something like a sandwich, and kind of get distracted halfway through. You see the plants, remember, oh, I need to water the plants. And, we all do that sometimes, especially if you're, cleaning an area and you remember something. Oh, I forgot I had that. You get a little distracted. But unfortunately, with people with Alzheimer's, this is to a far larger extent, and becomes an actual hindrance to their everyday life. Impaired judgment and decision making. There might be some confusion that makes the person unable to make choices that they usually would. They can also sometimes be impulsive in ways that they weren't before. There can be language issues, so difficulty remembering what a word means or finding the right words. Spatial memory is also associated with Alzheimer's. So, living in a neighborhood your whole life and one day finding it very unfamiliar, as well as behavioral or psychological symptoms. This is one of the symptoms of dementia and Alzheimer's that's not necessarily talked about as much, where people who have Alzheimer's can experience great amounts of depression, anxiety. Somebody who's typically very mild-mannered can become very aggravated. And it can be very distressing, of course, to anybody who loves them and takes care of them, but something that we want to talk about when it comes to symptoms.
Can I ask another question?
Sure.
So can you go back to the last slide?
Yeah.
So the behavioral and psychological symptoms,
Mhm.
because that also mean not aggressive.
Mhm.
I know that can lead into that too.
Sure.
But defensive. No matter
Yeah.
what somebody says, it's misinterpreted to be, okay, you're arguing with me now. You don't want me here, but it's the complete opposite.
Yeah.
So that all falls underneath that.
Yeah, I think when we talk about dementia as well, there's absolutely irritation can be a big change when it comes to psychological symptoms. There's also a large association. There's a lot of fear surrounding dementia. We don't talk about it a lot. And so when they may privately be worried that, I've noticed these changes in myself, and they may experience some denial and some defensiveness. So when it's especially early in treatments, trying to get somebody to seek out treatment, there can be a lot of defensiveness. So, that's why, presentations like these are nice to have a better understanding. So if you do have a loved one that you're concerned about, you can you have the knowledge to help lower their fear and make it a little more, accessible. But absolutely, irritation can definitely be a symptom.
Staying on this slide again.
Mm-hmm.
Do you guys actually, in the presentation, do you talk about sundowning?
We don't, but that's a fabulous
So
point.
can I ask that question on this
Absolutely.
slide?
Yeah.
So obviously I'm experiencing something with a family member. So this is why I have all these questions, because it's something I am actually personally experiencing. So sundowning.
Mm-hmm.
I'm noticing some changes now, and I'm also noticing changes with regards to climate changes.
Yeah.
So, I mean, I'm sure there's studies on that as well, and you might have some information to give on that. I would greatly appreciate it.
Yeah, sure. So this is my understanding. I don't have the MD behind my name, so
Right.
take it with a grain, but I did do my undergraduate in neuroscience. So I have a little understanding of, especially when it comes to sundowning. Is anybody familiar with the term? Yeah. So it's this idea that with a lot of neurodegenerative diseases, that once it goes, they may not be asymptomatic during the day, but during the night, these symptoms get worse, often associated with a lot of confusion, those behavioral changes that we talked about. Agitation, exactly. So, the science is always trying to find a reason why. A large thing that we associate, we know that during the winter months, for instance, individuals can have SAD, so seasonal affective disorder, and have greater depression, anxiety, and sunlight is a really important for our body and important for our brains. We have a nucleus in our brain that registers sunlight, and it tells your body when to fire off certain things, like when to wake you up in the morning and kind of regulate itself. When it gets dark out, just and there's different arguments as to why, but some idea is that it gets darker, it's harder to see, and just having that almost atmosphere when you're already confused kind of heightens that. But as well as if the individual isn't sleeping very well, it can be when they're at their most, sleepless, let's say. But yeah, so it's definitely a well-documented thing throughout, and it's well documented in hospitals, for instance, like the night shifts are definitely,
Noticing.
yeah.
And do you know if there's any studies around or stats with regards to those? I don't know what they're called right now. Happy lights, the sunlights that you put in.
Mm.
So
Yeah,
those,
Carolyn has those.
yeah.
yeah. So does that, like, is there any studies around that to actually help with sundowning and to adjust
That's a great,
the lighting?
yeah, that's a great question. I think when it comes to sundowning, I'd be interested to see if that would completely negate the effects, or if you'd still see just for like the duration of time of being awake. But I do know that they use that in treatments for depression and other like behavioral conditions, anxiety, stuff like that.
Yeah, you can buy the lights too.
Yeah.
That give you daylight.
Carolyn, do they work?
Yeah.
We have one for our son, and they do work.
Yeah, absolutely.
Yeah.
Especially during winter months, if you find yourself lower during winter months, just having these like happy lights, they're called, or just these daylight kind of, they simulate daylight, can be very helpful to some people don't find it helpful at all, but for a lot of people it can be beneficial. So absolutely. Yeah. All right. Any other questions before I move on? All right. So diagnosis. And part of the reason we talk about this is because, like we said, with sense of denial or fear, knowing how the process looks can be helpful when you're talking to somebody who you may be concerned about whether or not they're developing Alzheimer's. So, and I know I'm running a little long here, so I'll try to keep it concise. So first, typically it starts with a family physician, and where you bring up these concerns, and they'll proceed with a history as well as a physical exam. So this will be, and this is mostly consists of a neurological exam. So for instance, they'll check your motor reflexes. Are they slower? How are your, different changes that tend to precede Alzheimer's diagnosis? And, how you can converse with them. Do they notice anything in your speech? And depending on how they feel your assessment goes, they may put you into cognitive testing. So there's two types of exams. They're there just to give you the names for them. But those are just general. We have the mini mental state exam and the Montreal cognitive assessment. Those are just done to get a better understanding of the patient and help for diagnosis. That will then allow them to refer you to a specialist. The specialists are typically neurologists. Even better if you can find a neurologist who specializes in neurodegenerative disorders, and they'll proceed with blood work. They'll do an MRI and a CAT scan to look at your brain. And because we know that in individuals with dementia, they're going to have a change in their actual brain.
So something shows up in the blood work?
For blood work, I wonder if it would be whether any of the proteins would show up, but I think it might more so to ensure just your general health as well. Make sure it's nothing else, because there's lots of different things that can impact your cognitive well-being. And so just to eliminate those other options. And then post-diagnosis, we'll have the neurologist and the family doctor following up with you to discuss treatment options, support services, and strategies to manage the symptoms. Unfortunately, it's not curable, but there are lots of medications to help kind of minimize the symptoms as they occur.
I have a question. They can also have a geriatric assessment, correct?
Yes,
Yes.
absolutely.
Yeah. That's all. Sorry.
Yeah, no, thank you for bringing that up.
So another thing in regard to blood work,
Mhm.
like our son has a traumatic brain injury. It's not Alzheimer's, he's 32. But the reason for the blood work is the medications have to be monitored.
Mhm.
And one of the medications you're off, or several of the medications you're often put on, might have different responses to the liver, for example. So our son needs liver testing done consistently to
Absolutely.
make sure the medication for his brain isn't damaging other things in the body.
Yeah,
So that would be another reason for the blood work.
absolutely. And if they do have like pre-existing liver damage, for instance, what medications they can be prescribed would be, have to be considered. But thank you.
With regards to the MRI and the CT,
Mhm.
with the diagnostics from that, do you know if they're looking for like lesions, swelling, deterioration?
That's a great point. So in your brain,
Oh,
there
okay.
is no, that's great. It's a great segue. In your brain, lesioning is associated with natural aging. We all, after the age of 25, you start developing lesions in your brain. It's a bit alarming to know that, but that's okay. It's normal. It's expected over time. But in somebody with Alzheimer's disease, you would see this to a far greater extent. Almost as if their age is, or their brain is older than they actually are. As well as a shrinking in, so atrophy, so shrinking in areas of the brain, especially the hippocampus. So the hippocampus is the memory center of the brain. It's called hippocampus actually after, that's the Latin word for seahorse. And it kind of looks like a seahorse. If you ever, not in this picture here, but if you looked at it side on, it looks like a little seahorse with a curled up tail. So that region in particular they look at. And if you look at the left versus the right, that region is much smaller. So if you were to see this on an MRI or a CT, this would be an indication of Alzheimer's disease. And now we're going to go into risk factors. So first we'll do the non-modifiable risk factors. So these are things that unfortunately we cannot change. So age, we're all going to get older, and age is not something that we can modify. And unfortunately, as we get older, our risk of developing dementia and such as Alzheimer's does increase. Family history is also a potential risk factor. So if you have parents or siblings with Alzheimer's disease, you are at a heightened risk. It's important to remember that that doesn't mean you're going to get Alzheimer's, just means that the genetics that could have caused their Alzheimer's could be within you. But not all types of dementia are caused by genetic causes are associated with it. So even if you do carry the gene, that might not be what causes your type of dementia. Such as if you have a stroke, vascular dementia could be caused by that. And as well, when we talk about genetics, there's particularly, I believe, in Newfoundland, the APOE gene is particularly prominent. Or actually, it might be Quebec. I think it's Quebec, sorry. Quebec has a large, a high prevalence of dementia. So there's a lot of studies that kind of involve that, and we've noticed that the APOE4 gene is particularly influential in terms of your ability to dementia to occur. But if you're worried about it, a lot of the times people who have these really pronounced genes do genetic testing, and if an individual has dementia, they may have genetic testing done if that's the fear. And so you would likely know if a family member has that gene or not. But it's always something that they will like to check out. But luckily for us, there are things we can do to lessen our chances of developing dementia. So these are things we can change to some degree. Of course, some people may have limitations. So high blood pressure is associated with a higher risk of dementia. So anything that can lower your blood pressure, as well as lowering your cholesterol, can be beneficial. Diabetes, because it's associated with high blood pressure, also can be contributed. And hypertension, these are all things that can increase your risk. Physical inactivity increases your risk for developing dementia. So getting out and getting involved, moving a little bit, whether it's chair yoga, just doing small movements, anything can, to some degree, lessen your risk factor. Hearing loss is associated largely with dementia, but it's not because the hearing loss causes dementia, but the lack of social interaction. Because when you have hearing loss, some individuals, you can find it very frustrating to have to, ask people, or embarrassing to ask people to repeat themselves, frustrated that you can't hear everything of the conversation. So hearing loss is associated with social isolation, and that heightens your risk of developing dementia. There's also depression that heightens your risk. Social isolation, like I mentioned, smoking and alcohol are known to increase your risk of dementia, and reducing that even to some degree. So if, let's say you smoke a pack a day, reducing that to a half pack a day. These small changes, if you feel like you can't go all the way and completely cutting it out, just those small changes will help lower your risk. And as well as air pollution. We're pretty good here in Newfoundland when it comes to air pollution, but there's always regions, especially depending on where you work, that air pollution should be considered. So true or false, there are things I can do to keep my brain healthy.
True.
True.
Nice. Wonderful. And now go on to Brianna.
Okay, so I feel like that was a lot of gloomy talk. There are things that we can do to reduce our risk, as Theo mentioned, as well as some different things that we can do to manage the disorder. So we'll get into that here. So piggybacking off of what Theo said, exercise is a really good lifestyle change that we can do to manage our risk of Alzheimer's disease and dementia. And again, this doesn't mean you have to go to the gym, lift weights, run a marathon. Do what you can, whether that be chair yoga, shuffleboard, taking a brisk walk around the neighborhood, snow clearing, especially these days. Doing what you can. Moving is not only good for your body, it's also good for your brain. And again, I really, really want to emphasize that social engagement, whether that be talking to your friends, workers, family, going to church, going to events like this, going to bingo. All of these things count as social engagement and really, really does help prevent the risk of Alzheimer's and dementia. And again, with that, if you are feeling that you're having some hearing impairment, because that is really associated with isolating yourself, go to your doctor and mention it to them. They would be more than happy to refer you to get a hearing test done, just to make sure that everything's good in that regard. The next thing that we can do is to make sure that we're eating a good diet. There are two diets that are recommended. They're called the Mediterranean or the DASH diet. And I won't get too much into them, but it's pretty much eat a rainbow. So they really recommend that you make sure you get your fruits, your vegetables, and they put an emphasis on some other types of protein that aren't as common in Newfoundland diets, I would say. It's not your red meat. But we do love our fish. So they do recommend fish and nuts as some of the proteins. But you just want to make sure that you're getting a really good balanced diet to make sure you're getting all your vitamins, your minerals, and those antioxidants that are really good for your brain.
But don't you need so much meat?
You do need some meat, but they just put more of an emphasis on the fish for protein, more so than your red meat, just because it's a little bit more healthy for your heart.
And it has things like omega acids, I know growing up,
Omega threes.
cod liver pills.
I
Growing
don't
up.
know.
Yeah.
You know, my parents always gave me and my brothers those, and part of the reason why that's been in use for so long is because of the high levels of omega fats. So that can be very helpful for the brain. So and you can still and should still, you know, if include different meats in your diet, different fruits and vegetables, but just diversifying it a little bit to make sure you're including as much as possible.
The next thing that we can do is reduce stress, which is definitely easier said than done. But that can be any way that you find relaxing, whether that be reading a book, going for a walk, doing some yoga, talking to friends, those types of things. Whatever you do that you find helps you relax and de-stress will be beneficial in the long run, because reducing your stress levels has been shown to help your sleep. It's been shown to decrease you're less likely to gain weight with less stress, and those types of things, which kind of tie into our heart risk factors that we were talking about before. Similarly, you want to make sure that you're getting enough sleep every night. So around 7 to 9 hours is recommended. And to do this, we recommend good sleep hygiene. What I mean by that is to make sure we don't have any distractions when we go to sleep. We're not using our phone for at least an hour or any screens before an hour before we go to bed. Make sure you have a dark room to sleep in. There's no distractions, which is, again, easier said than done sometimes. But again, getting a good night's rest is really good for your mental health. It decreases your chance of gaining weight. It decreases your stress, those types of things. So it definitely helps some of the other risk factors that we did mention previously. And again, making sure we're being heart healthy. So seeing your doctor regularly just to make sure that everything's okay. So getting your blood pressure checked, your cholesterol and your blood sugar. And I know it's easier said than done to see a doctor sometimes, especially you don't have one or if there's a really long wait to see yours. So calling 811 could definitely be an option to get a requisition to get blood work done, as well if you're looking to get your blood pressure done or checked, but you don't have access to a doctor. Some of the pharmacies actually have those automated cuffs where you can just put your arm in, it'll take your blood pressure, and some of them will even tell you if it's high or if it's low or if it's normal. And then of course, if you do have concerning results, you can bring that to a doctor or nurse practitioner. And they do also have the automated cuffs that you can buy at any pharmacy, Walmart, where you can take your blood pressure regularly at home. And finally, as Theo mentioned, reduce the amount of alcohol you consume or how much you smoke. And that doesn't have to be a cold turkey quit, whether that's going from smoking 2 packs a day to one to a half pack, or a half pack to none. Any amount of reduction is beneficial for your heart, your brain, your whole body. And if you are having concerns about quitting or trying to reduce, or you're having anxiety or just finding it difficult, you can talk to your doctor about it and they can give you some resources and some medications that might be able to help kind of beat those cravings. Okay, now I'm going to briefly touch on the medications that are available for Alzheimer's disease. The really important thing to note about these is that they don't cure the disease or stop its progression. So taking these medications, you're still going to have Alzheimer's. The symptoms will still progress. They just won't progress as fast. So some of the medications are listed there. I won't get too into the biochemistry of them and how they work in the brain. But taking these medications will stabilize the symptoms, so you won't progress as fast in the disorder. So if you take them, you can have kind of a longer time where your memory, your attention, your thinking, your language is stable, which of course is beneficial to the patient. But that's not to say we won't ever have a cure for Alzheimer's disease, because there are clinical trials ongoing right now where they're looking at how to stop the disorder. So things could look different in the future. Hopefully, by the time we're practicing, we might have some cures, but for now, we do have medications that can slow down the disease. This is also why it's important that if you are noticing these symptoms, it's good to see your doctor early on so they can put you on these medications, because the earlier you're put on, the more beneficial they are.
So can I ask a question for
Yeah.
you? So shouldn't you be assessed first to find out for sure and confirm, and also what level?
Yeah, sorry.
Yes.
This you wouldn't be put on these till after you've been diagnosed, but you have to seek out the diagnosis first. Sorry, that's what I meant.
Yeah.
Okay, so to summarize, what can we do about Alzheimer's disease? Get a little cut off on the bottom, it's okay. First is just knowing the difference between dementia and normal aging. And I know we've talked about this point a lot, but it is really important. So normal aging, it's totally normal to forget things as we age. I forgot where my keys were this morning. But that doesn't mean that you have dementia. Dementia is when it does start to impact your day-to-day functioning. I can't remember how to drive a car anymore. I can't remember how to pay my bills, how to cook meals. I can't remember what medications I'm taking or when to take them. That is when we're more into a dementia territory than normal aging. And that's when you want to make an appointment with your doctor or have a loved one make it for you, just to kind of figure out what's going on there and go through the diagnostic route that Theo mentioned. And again, we want to make those healthy lifestyle changes that we mentioned previously. I'm not going to get into all of them again, but I do really, really want to emphasize making sure that we're staying physically active, we're getting a good diet, good sleep, and really making sure we're keeping those social connections, because it really, really has been associated with decreasing the cognitive decline in Alzheimer's and dementia. And again, with that, making sure that our hearing is good, because again, it is really common to get a little bit of hearing loss as we age. And I do really want to emphasize, if you have any concerns, please visit your family doctor. They're there to help you. They want to help you, and they want you to be the best you that you can be. And if you do have a loved one or someone you know that's been diagnosed with Alzheimer's disease, the Alzheimer's Society of Newfoundland is an amazing resource. They have a lot of different projects available that people can avail of. So it's not just for people with Alzheimer's, it's for their caretakers too. For example, they have support groups for people, the caretakers of those with Alzheimer's. For people with Alzheimer's, they have music therapy, art therapy. They have education of, okay, I just got diagnosed. What can I expect in the future? What are my symptoms going to look like in the future? Those types of things. So it can be really, really beneficial, not just to the patient, but for the caretakers and the loved ones. So I really want to emphasize that. It's a really good resource, and we do have it here in Newfoundland. So with that, I think you did a really good job the first time, but we'll go through just to emphasize the points. So is Alzheimer's a normal part of aging?
False.
That's true. So do people with Alzheimer's lose their recent memories before their older memories?
True.
Yes.
Yep. Social isolation, so keeping to yourself, can increase the risk of cognitive decline in Alzheimer's.
True.
Yep. And if someone in my family has Alzheimer's disease or dementia, it means I'm going to get it.
Oh.
It's actually less than 5% of people that have that inherited fully Alzheimer's disease. It's called familial Alzheimer's.
And bonus question. If you notice something in yourself or in one of your loved ones, what should you do?
I'm sorry, can you repeat that?
If you see some type of decline in yourself or in your loved one, what should you do?
You should raise a hand and see if you're providers.
Yes.
Okay.
Oh. I'm gonna ask Sherry. Sherry, are you able to? There we go.
There we
Thank you
go.
so much.
All right. Sorry, that was our presentation. So if anyone has any questions, feedback, anything at all, we're more than happy to answer. You can also.
I need to go.
Yeah.
Because I have a class. So
Life of a med student.
I do have one question.
Yeah.
Hello?
Thank
Oh,
you.
Theo. Bye,
Thank
Theo.
you. Bye.
I do have one question. You're mentioning that, of course, the Alzheimer's Society is an amazing society here. But I've also, there is another resource that people can avail of. It's from Tasmania University, one of the world leading studies for Alzheimer's disease. So they offer courses, if anyone wants to know, online free. And there's such as understanding dementia, if your loved one has dementia, etc. So that is another good resource to avail of.
Sorry, could you repeat the name?
It's the University of Tasmania in Australia. And they, and they offer courses free online. for example, understanding dementia, etc., etc. And if you go on their website, they'll let you know what courses are available, and you can take avail of these courses as well.
Perfect. Thank you.
Oh, you're welcome.
Yeah, that's good.
Abby and Brianna,
Yes.
thank you. You did a great job.
Thank you.
On behalf of my profession, I'd like to say, don't forget the role of the speech language pathologist,
Absolutely.
because we can help those people with some of the things you mentioned in regard to aphasia, like forgetting language, social interaction, memory aids, social skills. And I work a lot in long-term care in the north, and we do a lot of group therapy.
Right.
And you're absolutely right. Like, a lot of these people just want to stay in their room and do not want to engage because of the depression, and they know something is wrong. So I think speech, I may be a bit biased, but I do think speech language pathologists are
Absolutely.
a big part of the team
Yeah.
in Alzheimer's.
100%. Occupational therapists, physiotherapists, nurse practitioners, doctors. Alzheimer's does require a multidisciplinary team, and everybody has an equal and important role in helping those with Alzheimer's, for sure.
Takes a village.
It does.
Mm.
It does.
Yeah.
Yeah.
Does anybody have any questions online? If you'd like to, oh, I do see a hand raised there by my Colleen. If you'd like to take yourself off mute, Colleen, and ask a question.
I'm unmuted.
Oh, perfect.
Yeah, so I guess I had a question there. I have two family members who have dementia, two of my siblings. My brother has passed away with dementia. My sister is currently 79, I'm going to say, 78, 79. She has just recently gone into the long-term care dementia building in Corner Brook. So I think for me, it's a constant in my mind, obviously. I do all the things that I'm supposed to do, that sort of thing. However, what I have found is that because I'm, younger, I guess I'm in my, I will say they were both in their early 60s or mid to late 60s when we started to notice things. I sometimes find that people don't take you seriously when you say you're concerned or things happen. So, if you say it maybe to not my new GP, because I have a new one now, but if you've said it to people, they might say, oh, don't be silly. You're not going to get dementia. Well, no, I don't really know that. So I think for people who have family members, I really don't know what I could do. Like, I don't know how to be tested. I don't know if there are any, groups that are doing research on family members. I don't know any of those things because I'm not sure where you would go to find out that information. Like, I would like to be tested. I would like to do, some kind of testing just to see if I may have that gene, because I don't really know that. My brother passed away. My brother had Lewy body dementia, I guess it is. And I think my sister would probably have what I would term vascular dementia, perhaps from mini strokes and things like that. So I guess I feel a little as if I'm not really sure how to, I guess, find more information for me. I know all the general information because it is fairly general. That's my question.
Alrighty. The Alzheimer's Society would be a good place to look for people with siblings or loved ones that have had diagnosis of Alzheimer's or other forms of dementia. Another thing I want to note is, I think you mentioned that your sister had vascular. That's not really inherited as much because it's more so things that have happened throughout your life, like strokes, for example, a buildup of cholesterol in your arteries, those types of things. So that isn't so much inherited. When we start to worry about the inherited form of Alzheimer's, that's when people typically get it early on in their life, like more so their 50s before then. And I think you mentioned, you cut out a little bit there, that your siblings were a bit older when that happened. So if that comforts at all, you would be less likely to have the familial form of Alzheimer's or the inherited form just from that. However, if you are experiencing any types of memory difficulties or stuff like that, sometimes it's good to have a collateral person to come with you. So someone that knows you really well. So for example, I can take Abby with me to the doctor. And if I say, I'm having memory problems, I know I'm not myself, Abby can vouch for me. Abby's known me my whole life, and she can say, yes, there's been a difference in her in the past couple of years. That would really help. Where we do have, Newfoundland particularly has an aging population, it is a bit hard for doctors to refer or kind of do testing if you kind of don't have the criteria to go, which is really unfortunate because I definitely know people want to get tested, especially if you have that family history. But unfortunately, we are at the constraints of the healthcare system as well.
Yeah.
But if that answers your question, if you have anything else, I'd be more than happy to, or if Abby has anything to add on.
No, that was a great response. My only other thing would be if you do feel like you want to know more, you could maybe approach your GP and say, okay, for the next little while, I'd like to maybe do some cognitive tests and see how I do over time, just to see if there is any decline, because they have access to the mini mental status exam, the MOCA exam, and they may be willing to, okay, I'll see you every 6 months. Let's do these cognitive tests every time I see you to see if there is any change.
Okay.
And that'll allow you to see it over time, because you might not be able to see it acutely. So like right now, you might not see any big drastic changes, but assessing it over time might help as well. So that could be another avenue. The only issue with the genetic part is getting genetic testing is hard here, and it does cost money, which is terrible. But like Brianna said, where your siblings did get it in like 60s, mid 60s, we usually see that familial genetic onset happen early 50s, even before 50. So does that help?
Yes, it does.
Perfect. Wonderful.
Thank you.
Thank you. There's
Thank
another
you.
hand there.
There is another question in the chat, Catherine, or
Okay.
Abby, or this person is asking: is there any research related to the drugs taken to reduce blood pressure, high cholesterol, and/or diabetes? And can taking these medications contribute to Alzheimer's?
It kind of be the opposite. I don't personally know if there is a certain medication that is more likely to cause you Alzheimer's for cholesterol or diabetes. However, just from speaking from the risk factors, again, for vascular dementia in particular, making sure that your cholesterol and your sugars are in a normal range, and even if that means taking pills for it, would be beneficial to protect your brain. That's kind of my input on it. But like I said, I haven't personally seen any studies to say this diabetic drug will cause Alzheimer's. It's more so making sure your blood pressure is, sorry, not your blood pressure, your blood glucose or your sugars is good, is more so protective for Alzheimer's.
Yeah. And the thing with that is Alzheimer's and dementia in general is so multifactorial. It's not like cancer. You can say, okay, that's where the cancer is. That's where it came from. Alzheimer's is nothing like that. It is a combination of so many things, like we talked about, that you can't pinpoint it to just say this drug has caused Alzheimer's. So you do need to look at the full scope of yourself and the world around you to try and come up with a cause, which you may not get. So it's just important to know that there's not always a one reason why something happened, and that happens a lot in medicine, unfortunately. So it wouldn't be fair to say or to agree with the fact that there are some drugs that cause dementia.
Like, to piggyback off Abby, it could be lifestyle, it could be your food, your exercise, genetics, how you live your life. It's very big range of things that could cause Alzheimer's.
Thank you.
No problem. Elaine Dunphy.
Hi there. I have a question. I'm curious if any of you know about the work of Teepa Snow.
I'm not familiar, so I know.
No, she's based in the U.S. in North Carolina, and she's doing some incredible work around dementia and whether when people are losing their words, are they losing their nouns or their verbs? And then that sort of, it pinpoints where in the brain the issues are. And so she's got her own, if you look her up, Teepa Snow, Teepa Snow, as in we have copious amounts of it. So I just think that she's one to watch, and she talks about changing the conversation about not concentrating on all the things that are lost, but that are the things that are remaining when a patient has entered into dementia or Alzheimer's. So I just thought I'd add her name there, if you're looking for like different avenues to explore.
Yes,
Yes,
thank
thank
you.
you.
That's great.
I'd like to add on too while Elaine is there. Elaine actually teaches brain health fitness program to seniors called Ageless Grace. So welcome,
Nice.
Elaine. I'm so glad you
Thank
joined.
you.
Thank you.
That's why I wanted to hear all of the new things, because I'm super interested in all things brain health motivated. So yeah, awesome job.
Great.
And if anybody's ever attended one of her sessions or classes, she is phenomenal.
Wonderful.
Good
Thank
job.
you, Elaine.
Thank you.
Anybody else have a question they'd like to take themselves off mute or anything in the chat?
I've got a question.
Yep, yes.
You know, there's different games like Sudoku and
Mhm.
crossword puzzles
Yeah.
that you can do that's supposed to help.
Yeah.
Is there any one in particular that's recommended
I don't
or?
think so.
I don't think there's any one recommended over the other. Anything to keep your brain active. We learn neurons that fire together, wire together. So kind of the more you use your brain, the better it is, kind of thing.
Okay.
Yeah. And that goes back to if you enjoy it, keep doing it. Like if you say, okay, they say Sudoku is the best, I'm going to do Sudoku. But if you hate doing Sudoku every time you do it, no real point.
It's rising those stress levels.
Yeah, if your brain's working and you're having a good time, then I think that's good.
Thank you.
It's no problem.
I'm just going to read out a couple of questions that were asked during registration. Even though you've already answered them, but I want to address the people that asked the questions to say, we haven't forgotten about you, but I really do think it was answered. The first question was, is dementia or Alzheimer's inherited? We already know the answer to that, which was a no.
Mhm.
It says 4 siblings of my family have passed away from Alzheimer's. And that was, sadly, I'm so sorry to hear that. And it actually relates to one of the questions that I believe Carolyn just asked when we talked about different testings and things of that nature. Second question was, what are the early signs of dementia and how is the disease properly diagnosed so that any other form of brain disease can be ruled out? And you guys did a phenomenal job providing the education on that through the presentation and also with the questions that we had. Third question, I have dysteria. I would be interested in talking to other people with this affliction. Do you know if there's any groups, will that be the Alzheimer's Society?
Sorry, could you repeat it again?
Dysteria, I have dysteria.
Dysarthria.
Dysarthria. Sorry, my pronunciation wrong. Dysarthria.
Speech pathology.
Yeah. Yeah, so that would be a speech pathology thing.
So would somebody like to give a definition of what this condition is?
Well, okay.
No, you go. It's your world.
So dysarthria can again be multifactorial. There's no real easy answers, but assessment would involve oral motor therapy. And so when we do an assessment for dysarthria, we assess cranial nerves 5, 7, 9, 10, and 12, because those are the cranial nerves involved in being able to speak clearly and make the motor movements for speech and language. So we would be heavily involved in not only the assessment, but the interventions as well.
And do you know if there are any support groups in Newfoundland and Labrador for this?
Well, speech language pathology would be where you would go, but a support group specifically, I don't know, but groups that look after brain injury, brain health, meetings like this, the Alzheimer's Society, they would have that as a offshoot.
Okay. And I hope the person that asked that question, I hope you've gotten some knowledge and information. And if you haven't, please take yourself off mute or type your question in the chat. And I'll open it up again to the floor. If you have any questions, comments, anything at all for the group? No? Okay, so we're gonna, I'm gonna pose for questions again in a moment. So just as a reminder about Seniors NL, we have 3 different departments here. We provide information and referral, walk-in service over the phone and email, and a variety of topics, such as daily living, health, social and leisure activities, which we learned is extremely key to preventing and slowing down Alzheimer's. We have some tax clinics coming up in the St. John's area. If you're interested, please, by all means, reach out and ask when those sessions are. We have community outreach and engagement, which would be myself and my team. We provide a wide range of presentations such as this. We connect organizations up with guest speakers. We do bi-weekly newsletter. We develop educational material as well when requested. So if you do have a session in mind that you would like to learn more about, please, by all means, reach out, give us a call. When you call into our main number, all you have to do is say, can you please transfer me over to Catherine? We also have social prescribing, which is SP, and they're link workers. We have individuals that are working with our NL Health Services family care teams. And social prescribing is a means of connecting individuals to a range of non-clinical services in the community to improve their health and their well-being. And if you do not have a link worker associated in your family care team in your area, you can always reach out to Seniors NL. We're here to help.
Catherine, there is a question in the chat.
Perfect timing. I was just going to say, questions or comments?
This person's asking, can the person who recommended researcher on whether someone forgets nouns or verbs give us her name and any reference? I am deaf and I did not hear.
Can you repeat that question again, please?
It says, can the person who recommended the researcher on whether someone forgets nouns or verbs, would you please give her name and her any reference? I am deaf and I did not hear it.
Sherry, could you type in Tifa Snow in the chat? T-E-E-P-A.
Yeah, and it's already there. Thank you, Elaine.
She's from the University of North Carolina as well.
Yeah, cool.
It's there in the chat.
Any other questions?
There's no more questions in the chat.
Okay. I hope I thank our guest speakers today. It was phenomenal. They are actually booked up for the rest of the spring, which I'm hitting my foot on the floor. We are in conversations maybe for the fall because I do want them back for some other sessions. I'm not quite sure what yet, but they will be back. We do have a tea and talk coming up next week on March the 3rd. Be prepared for an emergency at home, a shelter in place by Red Cross. This is going to be done here, tea and talk, in our larger room where we can have a maximum of 30 people versus a small one right now for 10. So please, by all means, register online to attend virtually. If you want to attend in person, please email outreach@seniorsnl.ca or give us a call. And then on March the 4th, on Wednesday next week, we have Let's Talk About Anxiety, Stress, and Mindfulness. And that is a Zoom session only. So that one is online. Don't forget to register, please. Our website, or I should say the email is info@seniorsnl.ca. Telephone number 1-800-563-5599. Our website, www.seniorsnl.ca. Please go underneath, get involved, upcoming events or our events calendar, and see everything that we have scheduled. So thanks everybody for joining. Have a lovely day. And Sherry, I need you to stop recording.
Thank you.
Bye guys.
Thank you.
Thank you.
Thank you.